You're listening to Mistreated. I'm Kiwanuka. No other disease in the history of modern medicine has been neglected in such a way as Ehlers-Danlos Syndrome. That quote is attributed to Professor Rodney Graham, a leading EDS expert and rheumatologist. Ehlers-Danlos Syndrome is a genetic disorder that affects the body's connective tissue, which is primarily made up of collagen, and in the case of Ehlers-Danlos patients, the collagen is faulty. It can cause symptoms like stretchy skin and hypermobile joints. The result is that it doesn't support you in the way it's supposed to. Connective tissue is all over our body. EDS can affect the ligaments, skin, blood vessels, organs, eyes, gums, and digestive system. Some of the conditions that EDS can cause: physical pain all over your body, mast cells disorders, POTS, painful menstruation, chronic fatigue syndrome, Crohn's disease, neurodivergence, brain fog, retina detachment, swallowing disorder, depression, cranial-cervical instability, and many more life-altering conditions. EDS is commonly missed, undertreated, and misdiagnosed. It also can impact people in different ways. It can be mild for some, but disabling for others. In severe cases, it can be life-threatening. This uniqueness makes it harder to diagnose. According to a recent article published by the University of Toronto, the estimate to be diagnosed is between 4 and 16 years, and early diagnosis is crucial. Celebrities like Lena Dunham and Jamila Jamil have shared that they have EDS. Jamila Jamil shared that she was lucky to be diagnosed at age 9 because as a child, she knew that she shouldn't play contact sports. A lot has changed since Ehlers-Danlos Syndrome was first classified in 1968. Back then, 5 types were identified. Today, there are 13 different categories of EDS. Experts worry there are more classifications because of how understudied the condition is, and there are very few clinical experts who understand it. That lack of research means that people with EDS will continue to suffer. So, what else do we know? According to Canada's EDS Foundation, the most common type is hypermobile, and it represents 90% of those diagnosed with EDS. Women make up approximately 70% of diagnosed cases. EDS is associated with a higher risk of early pregnancy loss, preterm delivery, and stillbirth. And if you need a C-section, it can create additional dangers. In short, EDS is more than, quote, just loose joints.